whatever. So hopefully this reaches some people. If you guys are jumping on, if you can share this, that would be great. This is information that we really need to be spreading across the country, especially back east in New York. It's really bad. It's bad. It's worse than I thought. I am which I find it really hard to believe. I've been on a minute. I can't see any comments or viewers. If you guys are on, can you leave a comment or message me and let me know you can see me? There we go. Okay. The viewers are starting to come. Okay. Sorry guys, there's a bit of a lag on Facebook, but I wanted to talk about what is going on in New York, firsthand information that I have gotten from nurses that are there working on the front lines. Oh, thank you, sweetie. I'm a hot mess. But I wanted to share this. Can you guys hear me okay? Can you hear me? Let me know. Give me a thumbs up or some hearts if you can hear me okay. Okay. It might just be your mic then. Okay, so this is not hearsay. I have friends working in New York City, a couple of hospitals in particular. I have spoken to nurses all across the country, and I'm hearing different things. There's some similarities to what's happening in New York at some hospitals across the country, but for the most part, it seems to be New York. I'm just going to cut to the chase. The medical staff is killing the patients. It's not COVID. I'm going to start this off by saying I don't think nurses and doctors are malicious people and are purposely trying to murder their patients. From what it looks like you have half of the nurses looking at it and saying, this doesn't make sense. Something is not adding up here. And we have several doctors that have come out already and said the same thing, that it just doesn't make sense. Those nurses are afraid, and doctors are afraid to speak out. I mean, we see what happens when a doctor, a medical professional, any of them go against the narrative, okay? Look what happened to Wakefield, right? He's not the only one. So you have nurses, medical professionals of all kinds afraid to speak out and tell the truth about what they're seeing in their emergency rooms, in their ICUs, all of those things. And I'm going to go into how bad it is in a second. It's gut-wrenching. And then you have the other 50% that are so terrified of COVID that they've thrown all critical thinking out the window. They've thrown their medical schooling out the window. They've thrown how to typically treat ARD out the window. They've thrown away all of it. They're just so scared of this virus that the media and Fauci has blown out of proportion. If we look at data now, we know that the deaths are in line with the flu. In line with the flu. And Fauci's pushing to go get a vaccine. When it comes out, people are saying, the governors are saying the country is not going to fully reopen again until we have a vaccine. But the death rate is already that of the flu with the vaccine. We have a flu vaccine, right? The new data, which is how you follow science. This is science. Go look at the data of how many cases of COVID we have confirmed. Many scientists and doctors are thinking this has actually been around since like October or earlier. The death rate is so low, it's just like the flu. Yet we're not shutting down the country or the world for the flu, okay? That's without a vaccine. Like, come on, guys. So these nurses are so terrified of COVID that they are just going along with everything that they have been trained, even the doctors. they're just going along with it, even though it totally, once you guys hear what I'm about to tell you, your mind is going to be blown. And I really hope, please share this. I really hope nurses that are on the front lines, I am not a medical professional. I have several friends that are. It's something I'm very passionate about. This is information coming directly from nurses and doctors working on the front lines, working where they have a lot of COVID patients in their, even their clinics, okay? So what's happening in New York at the hospitals that I'm talking about? Basically, you go into the hospital with any type of upper respiratory issue, any respiratory issues, not even just anything respiratory. They immediately treat you COVID, okay? So I have to be careful with what I say on here because we're trying to figure out how to blow the whistle somehow without getting people in trouble or hurt, okay? So let's say a 35-year-old man walks into the hospital, has no previous conditions, is a healthy man, just has some respiratory issues. If his oxygen drops below 92%, and with over 6 liters of oxygen, they're venting. They're completely bypassing BiPAP, CPAP, all of it. Their justification for bypassing CPAP is that they don't want the open air circuit, okay? Whatever. So they're completely going away from BiPAP. They're going straight to venting. The medical community knows that venting people is typically a last-ditch effort. We know that the second a person is vented, they're saying that over 75% of patients that are being vented are not surviving. So a 35-year-old walks into the hospital, consents to being vented because they're so freaking scared of something that we now know is as deadly as the flu, that they're letting them vent them and put them into a medically induced coma or just give them sedatives. This is how they're treating patients in these hospitals. They are not giving hydroxychloroquine. They actually laughed when they were asked about it. They are not giving Z-Paks. They're not giving anything that we are seeing working all around the world. They are refusing to give it. They are not giving it even if you ask. They have everybody on that is COVID and non-confirmed COVID, like they both, and these people are together. They're in rooms together. They are giving them broad spectrum antibiotics and sedatives and venting them and then leaving them to die. A direct quote from one of the charge nurses: when somebody had a fever of 104 was, "Oh, we're not going to medicate him. He's dying." Excuse me? I'm sorry, what? You're not even going to try? They're being told to not perform any life-saving, no CPR, nothing that is going to be basically like you signed a DNR. Okay? Do not resuscitate. It's absolutely gut-wrenching. Like, it's so bad, okay? They're not doing the rapid tests that are giving you results in 45 minutes. They are using the ones that they have to send into the labs. And again, when asked why and how long those results take, they laughed and said 5 days if we're lucky. So what they're doing is they have COVID patients that are confirmed COVID, and then they have rule out COVID. They're ruling everything else out and assuming they're COVID. Rule out COVID. They're putting them in rooms together. These nurses are in the same protective equipment all day long. The only thing that changes is their gloves. If you know anything about cross-contamination or any of that, even the slightest bit, you know how bad that is. And the whole hospitals, the ones that I'm speaking about in particularly, I'm not going to say their names on here, they are considering the whole hospital COVID. So if you go in there for a heart attack, you go in there for high blood pressure, you go in there for whatever it may be, pancreatitis, You are surrounded by nurses in protective equipment that they have been wearing around positive COVID patients. Okay? They're killing these patients by venting them. Why in the world? I don't know if I already mentioned this. If they've already given 6 liters of oxygen and they are still not at 90 or 92 or above, they are venting them. Excuse me? If you have ever spent time in a hospital, I lived in a hospital for 6 months. I've spent a lot of time in hospitals. If you are a nurse, if you are a CNA, if you are any of those things, you know that is it's completely ridiculous to be venting somebody. These people are speaking in full sentences. Full sentences. They're alert, they're talking. They're just having some upper respiratory issues. Could you imagine walking into the hospital with a flu, cold, and a fever, and they're like, we need to vent you. And you're so terrified, so you accept it because you think that everybody's dying because of this COVID, when really it's the vents that are killing people. The problem is the oxygen level in the blood. Okay, that's the problem. This is not every doctor that is thinking critically and blowing the whistle is coming out and saying this is not ARD. This is not what we're used to seeing, okay? Usually when people are that severe, they can't speak to you. They are in distress. They can't breathe. These people are speaking sentences. These people are alert. They are not, it's not like they are struggling to the point that they need to be intubated. That is absolutely insane. Insane. And we know how dangerous it is to put somebody on a vent. There is a you're opening up room for infection. You're opening up room for lifelong issues. There's so many things that come with that, okay? So think about this critically. You walk into a hospital with COVID, you would think that we know hydroxychloroquine is working. We know that Z-Pak is working. You would think you would walk in and that would be the first thing that they start you on, right? Why? I'm talking about New York. Why would you start a vent immediately and refuse to give what is working? Why? I'm completely mind blown at what's happening right now. I don't think Trump's aware of what's happening. I think Cuomo's behind this. I wouldn't be surprised if the CDC's behind this. It's bad. The trucks outside with the bodies are real. They're very much real. Okay, first of all, if you guys were that concerned about COVID, why do you have a bunch of bodies that are infected with COVID just sitting in a truck outside? That's not how... That doesn't make any sense. Like, nobody is thinking about this critically anymore because they're so scared. I think that Trump keeps talking about the ventilators because hospitals were kept saying, and the media kept saying, we need ventilators. Trump's not getting us ventilators. The nurses I've spoken to, every single room in their hospitals in New York had its own vent. Every single room. And most of them were being used. That is extremely alarming, okay? So it seems like this is political and that this is about money because they get a lot of money for every COVID patient and they don't even have to test. A lot of them are not even testing. They are a rule out COVID, so now they can claim that they're a COVID patient. No autopsies are happening. Perfect scenario, they can't have guests there, so guess what? You don't have an advocate, you don't have a family member there with you, you don't have anybody to say, wait a second, something's wrong here. Like, if this is that bad, why are you in the same protective gear? Why are you not giving my spouse or my mom or my daughter or whoever what we know works? Doctors are saying when they use the Z-Pak and hydroxychloroquine that they're seeing their patients recover in a matter of 48 hours, 72 hours, complete, like, just completely better. It's insane. People are dying and they are leaving them on hospital beds for hours. Hours with a patient in the same room. I could never imagine, okay? Could you imagine? I lived in a hospital with a roommate. I could not imagine their dead body sitting there for hours. How disrespectful and disgusting is that? So we have no tests happening. They rule out COVID. We have no autopsies being done, no funerals, no family members or anybody are allowed to be there. So these hospitals can do whatever the hell they want, and they basically are. They're charting, and this is all firsthand information, you guys, from nurses that are working in these hospitals right now. The charting is horrible. Horrible, okay? Horrible charting. They're barely charting anything. Yeah, no witness, nothing. They're barely charting anything. If somebody codes, they're not responding. If your loved one codes, they are not responding. That is terrifying. That's their job. So not only are they being told, do not do any of the life-saving activities like CPR, any of that type of stuff, and basically putting everybody on a DNR against their consent, they are also not responding to codes. They're saying, oh, they're dead. Like, they're dying. Like, why would we respond to that? The drips are being put outside the hospital room. If you've ever been in a hospital for any situation, you know your drip is right there. The drip is being put all the way outside the door. How are your nurses supposed to properly assess you if your drips are all the way outside the door? They're not even going in there at all. That's terrifying. There are hundreds of nurses sitting in New York hotels on FEMA's dime that are not being used, while the hospitals are saying we are slammed, and some of them are. The nurses are freaking exhausted because they're venting everybody and killing everybody without even realizing they're doing it. And I can't imagine looking back 10, 20 years from now when everybody sees the truth and thinking, oh my God, I was a nurse, I was involved in that, and I thought I was helping people. It's absolutely insane. The drips are just broad spectrum antibiotics and sedatives. That's it. So they basically have their lines super long so that the drips can be outside the room. Are they, like, they're not even assessing their patients. Like, I'm mind blown at this information. Like, you should have seen my face when I was hearing all this information. Like, completely mind blown. They're not treating issues like if you go in with blood pressure, high blood pressure, or anything like that. They're not treating that. They don't care about that right now. The fact that the hundreds of nurses are sitting around and they're not using them really says a lot. Like, it really says a lot. Let me see if I forgot anything else. I took a lot of notes. It seems like this is happening in New York in the lower income hospitals. I didn't see any, or I wasn't told anything about morphine being given, just sedatives. I mean, I guess you can consider morphine something of a sedative, but not really. I mean, that's a opiate pain medication, so sure, it's going to make you drowsy, but it's not a sedative per se. I don't think so, not that I know about firsthand. So they're getting a lot of money for every patient that is COVID. They don't have to test them to prove they're COVID. They're getting even more money for everybody they're putting on vents. This is about money, and it seems like this is about politics. Like they want to make the numbers look high. They want to make Trump look bad. I just cannot believe that this is happening in 2020. The nurses are having to sign non-disclosures before going into these hospitals, being told that they can't take any pictures of the hospital, take any videos of the hospital, like any of that stuff, which, okay, sure, like I understand that because of patient privacy, right? But then at the same time, you're already sworn to that. And I know when I lived in the hospital, like I took pictures with my nurses. Like I loved my nurses. Like they took care of me for weeks and weeks and weeks on end. Like we would take pictures all the time. And nowadays with smartphones, like I would think that would be even more so. And we also have all these nurses recording themselves on frickin' TikTok dancing in the hospitals. But for some reason, these hospitals in particular, they're having to sign non-disclosures that they can't take any pictures or videos of the hospital. That doesn't make any sense. That doesn't make any sense. So I don't think Trump knows how bad this really is. I think that he knows that there's obviously something going on in New York. He has, talked about his issues with Cuomo and how they have not been agreeing on stuff. Everybody knows that. I think it's worse than he's letting the people know. I don't think Trump realizes that they are actually killing people by what they are doing. I don't think he realizes that. So what I have been asked to do is beg you guys, if you know anybody that is working on the front lines in New York, doctors, nurses, even if it's somebody who's an EMT and they're seeing some of it, like if you know anybody, the more voices that speak out about this and blow the whistle on it, the better. Okay? If 20 nurses stand up together, you are going to give other people the courage to stand up with you. We are literally letting... I don't even know who it is at this point. I don't know if it's the CDC. I don't even want to say the government because I don't think Trump's aware of this. I really don't. We are letting them kill people and use these nurses and doctors to do it. And these nurses don't even really realize what they are doing. And the ones that do are terrified to speak out. So if you are a nurse, if you are a doctor and you are working there, if you are seeing any of the same things happening, please speak out. Reach out to me. I can connect you with other people, with other nurses, with other doctors, and help you make sure your voices are heard, whether it's through social media, whether it's through... The press is probably not going to cover this, but we can get so loud where we force them to. Whether it's getting information straight up to the Trump administration, like we need people speaking out. If you are not a medical professional, I would really, really, really be very careful of going to a hospital in New York with any upper respiratory issues. I can't give you medical advice, but I will tell you right now, if I lived in New York City, there is no way in hell I would be taking myself or my kids to a hospital because we have flu-like symptoms. Absolutely not. Because even if you tell them, do not vent me, who knows what they're going to do? Who knows what they're going to do? Okay? If you are scared and feel the need to go to a hospital, please advocate for yourself. Do not consent to a vent. You do not need it. Demand. Like, if your oxygen is at freaking 92, you do not need a vent. You don't. You need to demand drugs that are working. Hydroxychloroquine, azithromycin, the Z-Pak. Like, there's a few of them that are actually working. You need to advocate for yourself. If it were me, I would stay home and treat myself, my family, the same way that we always do with the flu. And the data now, this has been here for what, 2 months now? The data now is showing that the death rate is the same as the flu. It's absolutely ridiculous, okay, you guys? This is not ARD. Go look up the doctors that are saying the same things, okay? I'm not the only one. The nurses are not, that I'm talking to and talking about, are not the only ones. This is happening, and medical professionals need to band together and speak out about it. Yeah, and that doesn't surprise me. I definitely think this is political and about money. I know some of these hospitals were bankrupt before COVID, and now they're getting a lot of money. They're getting a lot of money, unfortunately. So just be really, really careful, you guys. Take your zinc, take your vitamin C, freaking take care of your immune systems. I would stay as far away from a hospital if you could. If you are scared that you have flu-like symptoms, honestly, I would probably go to like a walk-in clinic type of thing before I stepped foot in an emergency department right now. Okay, I know that it's not the same across the country. I know for a fact several hospitals are treating people properly, are giving hydroxychloroquine, are not venting like that, are really truly only putting people on vents that actually need it. Like, this is not across the country. Do not take it this way. I just want to let you guys know what I am being told firsthand by people who are working the front lines at hospitals in New York. So just be cautious, be careful. Go to a regular doctor, like go to your normal doctor if you can, if you're really worried, instead of the emergency room, and just spread that to your loved ones. Like, I told my family, like, don't you dare go to a hospital and get a vent put in. Like, absolutely not. The chances of you coming back after being vented are slim to none, so please don't. And if you are a medical professional, like, there are a lot of other people working the front lines with you that are wanting to speak out, and you guys need to band together now more than ever. All right, guys, so I'm gonna hop off. I just wanted to let you guys know. I know I put up a little bit of a post yesterday and I'm totally being censored. But yeah, so that's the news. If there's any type of updates or anything like that, I will obviously keep you guys in the loop. All right, have a good rest of your day, guys.